right, guys, in this lesson, we're going to talk about depression. Now, I'm going to be as objective as I can here, but also I have struggled with depression my whole life. So I also hope to give you guys my unique perspective and my unique experiences, and I hope that that makes it really real for you. So depression can occur as a standalone condition or as a component of bipolar disorder. So if you remember, we talked about how some patients just find it very difficult to regulate their moods. And so in bipolar disorder, they may have some episodes of mania and episodes of depression, or they may just have this super low mood that is hard to manage or regulate if they have depression by itself. So let's start by just defining it. Depression is a state of low mood and aversion to activity that can affect a person's thoughts, behaviors, feelings, and sense of well-being. Even just looking at that definition, I'm thinking, yeah, that's about right. So we're going to use a similar illustration from the mood disorders lesson. So let's say this is our normal baseline mood. Again, it's kind of normal to have some swings from this. So let's say right here is kind of, sadness or mild depression. Usually lasts about 2 weeks or less, just this kind of normal set level of sadness as if something had happened. Usually you can still function, you can go about your daily life without much difficulty, but you're just kind of down. Again, most people would enter this state because something happened and then they self-regulate back up to their baseline. Now, in someone with depression, they'll often enter these low states for just no reason at all, and they may actually struggle to kind of get back up to normal mood again. It might take longer. Now, this is something I personally experience in cycles. So I may have a week or two where I'm just really sad for no reason. I don't want to be around people. I don't want to talk to anyone. I may even tear up or cry for no reason. I can still work. I can still perform my ADLs. I go about my daily routines. I'm just not as excited about it as I had been in the past. And that's actually a big sign of depression, is this loss of interest in kind of things you would normally have enjoyed. So this would be a mild level of depression. And then when you get to this moderate level depression, it's much lower than just a normal level of sadness. It's more persistent, it lasts longer, and it really starts to affect your thoughts and your behaviors. People may sleep a lot. They may just be really fatigued and have no desire to do normal daily functions. They may not do their own ADLs. They may not want to shower, brush their teeth, or do the dishes. They may overeat or drink alcohol to self-medicate, or they may not eat at all. This is not manageable. This is not a manageable level. You cannot stay here for an extended period of time and be healthy. They may cry all the time for no reason. You may even start to see suicidal ideations, although sometimes they just don't have enough energy to go through with it. And we'll talk more about that in the suicidal behavior lesson. Now, the thing is, when you hit severe depression, I really want you to see how much significantly lower this is even than the moderate depression. It is intense. It is pervasive. It affects every single aspect of your life. You may even see patients who experience hallucinations and delusions at this level. You will very often see suicidal ideations, and often they're so desperate to end the sadness that they will likely follow through on those thoughts. So it's important to ask if they have a plan. Now, I'll be honest, guys, I actually lived kind of back and forth between moderate and severe, mostly hanging out probably around here, just under severe, for about 6 months, about a year ago. I was never suicidal, but I had days where I refused to get out of bed. I didn't want to get off the couch. I slept all day. I cried multiple times a day for no reason. It even makes you start to feel like you might be crazy, like you're broken. I went weeks without brushing my teeth. I, went days or more without showering. I ate anything I could easily get because I just wanted to numb the sadness. I couldn't help around the house because I had no energy. And I just remember feeling this compounded sense of guilt, like I was a bad wife, and it just made the depression worse. So let's just say 2017 was a really bad year for me. But now I can look back and I can say, wow, knowing what my patients are going through from such a personal perspective is going to affect my compassion and my empathy for them. And I have such a new respect for people who struggle with these levels of depression and still manage to get out of bed and do their ADLs and go to work every day, because I'm telling you, it's hard. And these people are probably some of the strongest people that you'll ever meet. So all that being said, let's talk interventions. So I'm going to share the most important things you need to know, and then I'll share what worked for me. First things first, remember that safety is always first. We need to be doing a self-harm assessment, okay? For all clients who might have depression or who have been diagnosed in the past, ask very, very directly, do you have thoughts of hurting yourself or others? If they say yes, do you have a plan for how to do that? If they have a plan, they are more likely to follow through on it. So once you have asked those questions, if yes, they are have thoughts of hurting themselves, even if they don't have a plan, they need to be in suicide precautions. So you're going to follow your facility's specific protocols. Most of them include a one-to-one supervision, direct observation by a sitter, and within arm's length at all times. Guys, this means they don't even go to the bathroom by themselves, okay? We'll also remove anything that could possibly be used to harm themselves from the room. This could be a phone cord, monitor cables, if possible. You know, if you're not in a situation where they need to be monitored continuously, pull out all of the monitor cables. They'll get plastic utensils. They won't get real, knives. Some places will go so far as to move even their personal belongings, like their cell phone, and they might even restrict visitors. So it just depends on the severity of the situation. And you also just need to make sure that you know your facility's policy. So in addition to suicide precautions, if necessary, we also want to promote other things that are going to help. So in addition to suicide precautions, if necessary, there's other things that we'll do for clients with depression. We want to promote really good oral intake of good nutritious foods and lots of fluids and normal sleep-wake cycles. We don't want these clients sleeping all day, okay? We also want to encourage them to perform their ADLs and help them out, if they need it. I've had clients with depression who refused to bathe themselves, and they made us give them a bed bath even though they were perfectly capable. So we need to encourage them. Sometimes we'll let them start with one thing, like they'll do their private parts, and then we'll let them do their face as well. And we'll just kind of add things on until they are working up to being independent doing those things. We also want to encourage expression of feelings, and we must validate their feelings. I'm telling you, the one thing that helped pull me out of my severe depression more than anything else was someone actually saying to me, like, it's actually okay to be sad. It's okay to feel upset, but you still need to take care of yourself, right? So let's find a different coping strategy. Or even something like, that situation was really hard. I'm so sorry that happened to you. I can understand why you'd be sad about that. This is not the same concept as, agreeing with a hallucination or a delusion. We still don't do that. But feeling like you're not crazy, like what you're going through is real, that there are options for you, is so empowering. The other thing you want to do is really be present when you're with them. Even if that just means sitting in the room with them or letting them cry, make time for that. It makes them feel a lot more valuable. And when you feel like your life is more valuable, then you want to be a part of it more. And when it comes to activities, start with simple activities that promote a sense of accomplishment, coloring, card games, drawing. For me, I started making little baby hats, crocheting them to donate to the NICU. They each took about 30 minutes to complete. I'd make maybe one a day. And it just kind of gave me a way to say, hey, cool, like I accomplished something today. You can even set small goals each day. Like you might say, today I want you to be up out of bed and brush your teeth by 9 a.m. And so I still have a tracker that I use to check a box when I do my morning routine, like washing my face and brushing my teeth, and when I exercise and when I meditate. And it makes me feel like I'm accomplishing things, and it's really helpful for that empowerment and motivation. So, nursing priorities for a patient with depression: safety, of course, coping, and mood affect. Do that self-harm assessment, provide alternative activities, encourage achieving those small goals, and make sure that you're validating their feelings. So let's recap. Depression is a state of low mood that persists for weeks, months, or even years, and it may affect the client's ability to perform their daily functions or even to take any interest in life. We always want to do a self-harm assessment. Remember, be very direct when you're asking those questions. And then we want to set goals and encourage activities that promote that sense of accomplishment and make them feel like they have value. We validate their feelings. We help them manage their symptoms. And now here, I really just want to make it clear that medication is an option. For me personally, with therapy and counseling and a whole heck of a lot of personal reflection, I've been able to manage without medication, but this is perfectly reasonable and a very helpful option for these clients. So make sure that you don't stigmatize that or make them feel like a failure for choosing medication. It's really a great option. Okay, I hope that it was helpful for you to hear a bit of what I go through. I was actually diagnosed with something called persistent depressive disorder, and it's something that I still deal with on a regular basis. So I hope this gives you a new perspective so you can make sure that when you have these clients, you're using compassion and empathy and really validating what they're feeling. I love you guys. Y'all are my motivation every day. So go out and be that nurse today.